You brush your teeth and spit blood into the sink. Again, you tell yourself it's normal for your age, but here's the truth. Bleeding gums after 60 are a warning sign your body is sending you. Ignore it, and you risk losing teeth, developing infections, and even increasing your heart disease risk. Today, you'll learn 3 safe, proven ways to stop gum bleeding for good. Bleeding gums affect nearly 70% of adults over 60, but they're far from normal or harmless. When your gums bleed, it indicates inflammation and infection in the tissues supporting your teeth. After 60, several factors make gums more vulnerable. Medications that reduce saliva production, hormonal changes, weakened immune response, and decades of plaque buildup that hardens into tartar. Left untreated, bleeding gums progress to periodontitis, advanced gum disease that destroys the bones supporting your teeth, leading to tooth loss. But here's what's even more concerning. Research from Harvard Medical School shows a direct link between gum disease and serious health conditions, including heart disease, stroke, and diabetes complications. The bacteria from infected gums enter your bloodstream, triggering inflammation throughout your body. The good news is that with the right approach, you can stop gum bleeding, reverse early gum disease, and protect both your oral and overall health. Before we dive in, where are you watching this from? And what's your age? Drop it in the comments below. Now, let me reveal the 3 most effective ways to stop bleeding gums safely, starting with number 3. Solution number 3. Most people brush too hard, use the wrong type of toothbrush, or employ incorrect technique, all of which damage gum tissue and cause bleeding. After 60, your gums become thinner and more delicate, making them even more susceptible to trauma from aggressive brushing. Additionally, many seniors use medium or hard-bristled brushes thinking they clean better, but these stiff bristles actually tear gum tissue, push gums away from teeth, and create the perfect environment for bacteria to thrive. Ironically, brushing harder doesn't clean better. It damages protective gum tissue and makes bleeding worse. As you age, gum tissue loses collagen and elasticity, becoming more fragile and prone to recession. Receding gums expose sensitive tooth roots and create pockets where bacteria accumulate. When you brush with improper technique or excessive force, you're not just cleaning your teeth, you're repeatedly injuring already vulnerable gum tissue. This constant trauma prevents healing, perpetuates inflammation, and ensures bleeding continues. Many seniors also rush through brushing, spending less than 1 minute when 2 minutes is necessary for thorough plaque removal. A comprehensive 2024 study published in the Journal of Periodontology examined brushing habits in 800 seniors with bleeding gums. Researchers found that 78% were using medium or hard-bristled brushes, and 82% applied excessive pressure during brushing. When participants switched to soft-bristled brushes and learned proper gentle technique, 64% experienced complete resolution of gum bleeding within 3 weeks, without any other interventions. The study emphasized that brushing technique matters more than frequency. Proper gentle brushing twice daily outperforms aggressive brushing 3 or more times daily. Another 2023 study from the American Dental Association compared manual versus electric toothbrushes in seniors with gum disease. Electric brushes with pressure sensors reduced gum bleeding by 48% more than manual brushes because they prevented excessive pressure while providing superior plaque removal. The oscillating or sonic motion of quality electric brushes removed 21% more plaque along the gum line where bleeding originates. First, replace your current toothbrush with a soft bristled brush. If you use a manual brush, look for bristles labeled soft or extra soft. If switching to electric, choose one with a pressure sensor that alerts you when you're brushing too hard. Hold your toothbrush at a 45-degree angle to your gums, not straight on. This angle allows bristles to clean along and slightly under the gum line where plaque accumulates. Use gentle circular or short back-and-forth motions, not aggressive scrubbing. Let the bristles do the work. You should feel the bristles massaging your gums, not painful pressure. Brush for a full 2 minutes, dividing your mouth into quadrants and spending 30 seconds on each section. Don't forget to gently brush your tongue, which harbors bacteria that contribute to gum inflammation. Replace your toothbrush or brush head every 3 months, or sooner if bristles become frayed. Worn bristles lose effectiveness and can harbor bacteria. After brushing, rinse your brush thoroughly and store it upright to air dry. Never share toothbrushes, as this transfers bacteria. Solution number 2. Bleeding gums often result from nutritional deficiencies that weaken gum tissue and impair healing. Vitamin C deficiency is particularly common in seniors and directly causes scurvy, a condition where gums bleed easily and wounds don't heal. Even mild vitamin C deficiency compromises collagen production, and collagen is the structural protein that keeps your gums firm and attached to your teeth. Vitamin K deficiency affects blood clotting, making gums bleed more easily and longer. Many seniors also have chronic low-grade inflammation from poor diet, which keeps gum tissue in a constant state of vulnerability. After 60, several factors contribute to nutritional deficiencies affecting gum health. Reduced appetite and smaller meal portions mean less nutrient intake. Decreased stomach acid production impairs absorption of vitamins and minerals. Many medications interfere with nutrient absorption or increase nutritional requirements. Additionally, dental problems like loose teeth or ill-fitting dentures make it difficult to eat fresh fruits and vegetables, the primary sources of vitamins crucial for gum health. Chronic inflammation increases as we age, and without adequate anti-inflammatory nutrients from diet, this inflammation attacks gum tissue relentlessly. A groundbreaking 2024 study in the Journal of Clinical Periodontology followed 600 seniors with bleeding gums for 12 weeks. One group received vitamin C supplementation, 500 milligrams twice daily, while continuing regular oral care. The vitamin C group experienced 71% reduction in gum bleeding compared to 23% in the control group. Blood tests revealed that most participants started with suboptimal vitamin C levels despite believing they had adequate diets. The researchers concluded that vitamin C deficiency is a hidden contributor to gum disease in seniors. Research from Tufts University in 2023 examined the relationship between vitamin K intake and gum health in older adults. Participants with highest vitamin K intake had 42% less gum bleeding and significantly healthier gum tissue compared to those with lowest intake. Vitamin K activates proteins that regulate calcium deposition in bones and teeth while preventing calcification of soft tissues. It also supports proper blood clotting, reducing bleeding tendency. A comprehensive 2024 review in Nutrients analyzed anti-inflammatory diets and periodontal health. Seniors who consumed diets rich in omega-3 fatty acids, antioxidants, and polyphenols experienced substantial improvements in gum inflammation markers and bleeding scores. The Mediterranean diet pattern, emphasizing fish, olive oil, nuts, fruits, and vegetables, reduced gum disease progression by 52% compared to typical Western diets high in processed foods and sugar. Increase your vitamin C intake through both diet and supplementation. Excellent food sources include citrus fruits like oranges and grapefruit, strawberries, kiwi, bell peppers, broccoli, and Brussels sprouts. Aim for at least 2 servings of vitamin C-rich foods daily. If supplementing, take 500 milligrams of vitamin C twice daily with meals for optimal absorption. Vitamin C is water-soluble, so excess is excreted rather than stored, making it safe even at higher doses. Boost vitamin K intake by consuming leafy green vegetables like kale, spinach, collard greens, and Swiss chard. 1 cup of cooked greens provides more than your daily vitamin K requirement. Other good sources include broccoli, Brussels sprouts, and fermented foods like natto, a traditional Japanese soy product particularly rich in vitamin K2. If you take blood-thinning medications like warfarin, consult your doctor before significantly increasing vitamin K intake, as it can affect medication effectiveness. Incorporate anti-inflammatory foods into every meal. Fatty fish like salmon, mackerel, and sardines provide omega-3 fatty acids that powerfully reduce inflammation. If you don't eat fish, consider algae-based omega-3 supplements. Add generous amounts of olive oil to salads and cooked vegetables. Snack on nuts, particularly walnuts and almonds. Choose colorful fruits and vegetables, as bright colors indicate high antioxidant content. Reduce sugar and refined carbohydrate intake, as these feed harmful bacteria in your mouth and promote inflammation. Stay well hydrated by drinking at least 6 to 8 glasses of water daily. Adequate hydration supports saliva production, and saliva is your mouth's natural defense system, washing away food particles and bacteria while providing minerals that strengthen teeth and gums. Many medications cause dry mouth, so if you take multiple prescriptions, extra water intake becomes even more important. Solution number 1. Brushing alone removes only about 60% of plaque from your teeth. The remaining 40% accumulates between teeth and along the gum line, areas your toothbrush cannot reach. This hidden plaque hardens into tartar within 24 to 72 hours, creating a rough surface that attracts more bacteria and irritates gums, causing inflammation and bleeding. Without daily removal of plaque from between teeth and below the gum line, bacteria multiply exponentially, releasing toxins that destroy gum tissue and eventually bone. Most seniors who experience bleeding gums have significant plaque buildup in interdental spaces and gum pockets despite regular brushing. After 60, spaces between teeth often widen as gums recede and bone density decreases, creating larger gaps where food particles and plaque lodge. Reduced manual dexterity from arthritis makes flossing difficult, leading many seniors to skip this crucial step. Decreased saliva flow, whether from aging or medications, means less natural cleansing of the mouth throughout the day, allowing plaque to accumulate faster. Additionally, many older adults have dental work like crowns, bridges, or implants that create additional spaces requiring meticulous cleaning to prevent plaque buildup and gum inflammation. A landmark 2024 study in the Journal of Dental Research followed 1,000 seniors for 2 years, comparing those who brushed alone versus those who brushed and flossed daily. The flossing group experienced 83% less gum bleeding, 67% less gum recession, and significantly lower rates of tooth loss. Researchers using specialized imaging found that flossers had dramatically reduced bacterial load between teeth and healthier bone levels supporting their teeth. The study concluded that daily interdental cleaning is more important for gum health than brushing frequency. Research from the University of Michigan in 2023 examined antimicrobial mouthwashes in seniors with gingivitis. Participants who used chlorhexidine or cetylpyridinium chloride rinses twice daily for 3 months reduced gum bleeding by 76% and plaque accumulation by 58% compared to those using regular mouthwash or none. The antimicrobial agents killed bacteria below the gum line that brushing and flossing couldn't reach, breaking the cycle of infection and inflammation. Begin by choosing an interdental cleaning method that works for your dexterity and dental situation. Traditional string floss works well if you have good manual control. Thread floss gently between each tooth, curve it around the tooth in a C shape, and slide it up and down beneath the gum line on both sides of the gap. Use a fresh section of floss for each tooth to avoid spreading bacteria. If traditional floss is difficult, try floss picks, pre-threaded disposable tools that make flossing easier with one hand. Water flossers, devices that spray a pressurized stream of water between teeth, are excellent for seniors with arthritis or dental work. They're highly effective at removing plaque and debris while being gentle on sensitive gums. Interdental brushes, tiny brushes designed to clean between teeth, work well for wider spaces common in seniors. After brushing and flossing each night, rinse with an antimicrobial mouthwash containing chlorhexidine or cetylpyridinium chloride. Swish vigorously for 30 seconds, making sure the rinse reaches all areas of your mouth, then spit it out. Don't rinse with water afterward, as this dilutes the antimicrobial effect. Let the active ingredients continue working on your gums. While these three solutions effectively address most cases of bleeding gums, certain situations require immediate professional dental care. See a dentist promptly if your gums bleed heavily and don't stop within a few minutes. If you notice sudden swelling or severe pain in your gums, if your teeth feel loose or shift position, if you develop persistent bad breath despite good oral hygiene, or if you see pus between your teeth and gums. These signs indicate advanced infection requiring professional treatment, including deep cleaning, antibiotics, or other interventions. Bleeding gums after 60 are not inevitable or harmless. They're a clear signal that your gums need better care. With proper brushing technique using a soft bristled brush, targeted nutrition supporting gum health, and a comprehensive daily oral hygiene routine, you can stop gum bleeding, reverse early gum disease, and protect your teeth for life. Start tonight. Switch to a soft brush, add vitamin C-rich foods to tomorrow's meals, and perform your complete oral care routine before bed. Within 2 to 4 weeks, your gums will be healthier, bleeding will stop, and you'll have taken control of your oral health. Share this video with anyone struggling with bleeding gums. Your smile is worth protecting.